Moving from general personality tests to more specific, there's quite a few specific domain tests that are out there. Academic motivation is a common measure of personality that's not necessarily trying to measure multiple personality traits, but one particular personality trait, which has been found to be highly predictive of success in school. Beck's Depression Inventory Scale is again looking at just measuring the likelihood of someone suffering from or experiencing depression and depressive episodes. Binge Eating Scale, the White Bear Anxiety Scale, Math Anxiety, Loneliness Scale. Rotter's Locus of Control is a specific domain test. Creativity scales. There's the Locke-Wallace Marital Satisfaction Scale, Steinberg's Triangle Love Scale, which basically measures three different types of love, which again is trying. All of these scales are about differentiating a psychological construct of personality. So, for example, math anxiety is a personality trait. Some people are very comfortable around numbers, very comfortable around math, and find math very easy. And that isn't just a cognitive ability of can they do math, it's also the experience of anxiety. So a lot of times what we find is that if you adjust for anxiety, people may not be differing that much in their ability to do math. It's just people with high math anxiety tend to underperform because they experience so much anxiety when presented with math problems. So again, all of these are used to kind of try to differentiate people, both to kind of determine is there a problem, like with anxiety or math anxiety, but also sometimes just to identify people that might be performing better in certain environments, like the academic motivation, creativity, or the internal versus external locus of control scales. We can also look at behavioral assessments of personality. So basically, instead of looking at the personality, we're going to be measuring the behaviors. And the idea here is that instead of trying to get a personality construct as an underlying cause of behavior, let's just measure the behaviors. So generally speaking, when we talk about behaviors, we're talking about the antecedents, so the situation, the behavior, what actually behaves, or how the person behaves in an observable way, and then the cognitions of what they were thinking behind that behavior. And ways to look at behavioral assessments of personality include diaries, cognitive interviews. So, diaries is basically just asking someone to write down their thoughts, their feelings, and their behaviors. So, basically, you ask someone, think about everything that happened to you during the day. Talk about A, what the situation was, how you behaved, and what you were thinking when you behaved that way. Cognitive interviews is basically someone actually interviewing someone with the same purpose of talking to them about what was the situation, what was the behavior, what were your thoughts. This can also be done through pure just introspection, so someone basically going through the ABCs of their behaviors. There's low to no inference to personality specifically, so we're not necessarily focused as much on measuring the stable traits of personality with behavioral assessments. It's more about making people aware of are there trigger situations that result in bad behaviors? That tells us we can avoid those situations. When we're behaving in a certain way, are we behaving that way because of how we're framing or thinking about the situation? That might tell us we can change our cognitions to again influence our behaviors. So this is more kind of a behavioralist or cognitive behavioralist approach to personality. Less worried about the constructs of personality that make us different and more about the actual behaviors that result due to an interaction between the situation, the antecedents, and the cognitions, how we view those situations, that then result in either positive or negative behavior. So we talked about another way to get at measurement of personality, the indirect measures or projective tests. And we also talked about in the history of personality testing that these projective tests were often the first tests based on early Freudian theories of kind of the subconscious drive to personality. So a projective test employs a standard set of ambiguous stimuli. So any projective test is going to have one common thread, and that is that the person being tested is going to be being shown either pictures or sentences or images of some form that are fairly ambiguous. Their responses are reflections of their unconscious process. So they're asked to basically provide some structure to that ambiguous stimuli. So, what do they see in the picture? What story do they think is going on? And the idea here is that dependent on how they interpret that ambiguous stimuli, that's going to give us a better read of their unconscious processes. So we're basically trying to trick the conscious mind into revealing the unconscious mind. Responses and scoring are often not standardized, and there has been a lot of modern attempts to standardize these, but this really is a case of um, compared to a direct measure of personality, that if you answer fives on all five conscientious items, you'll be rated as having a high conscientiousness. And everyone that would rate that test would agree this person has high conscientiousness. There's not a lot of agreement of exactly what does it mean when someone looks at an ink blot and says, I see a spider running across a field of flowers. Because the responses to these ambiguous stimuli are incredibly varied, it's very hard to make a standardized set of scoring which allows people to make a standardized decision. So for instance, the problem is someone is shown an ambiguous stimuli. Their response is, I see a spider running across a field of roses. One psychologist or psychiatrist may go, well, you're talking about spiders, and spiders are a universal symbol of something that people fear and see as different. And therefore, you see yourself as being different, but you're wanting to be in a pleasant environment. Okay, that'd be one possible interpretation a psychiatrist could make. However, a completely different psychiatrist, given the exact same response, I see a spider running across a field of roses, may think, well, roses are a symbol of red and red's a symbol of blood. So you actually have a fear of something outside yourself that's coming to bring you harm, which is represented by the spider. Which is right? We don't really know. And that's the problem actually with projective tests, is that because they are so open to interpretation, there really is no standardization in how people score these tests. The test must be evaluated by a trained clinical psychologist. So there is no scoring guide. You can't take these online. And if you ever see one of them online, there's not a lot of reliability there either, because your response should be basically just open. You should be able to say anything to this ambiguous stimuli. So generally speaking, the people that use these tests have been trained to look for very specific symbology or very particular themes in how people respond in order for them to try to actually kind of assess this unconscious aspect of personality. Common projective tests include the Rorschach ink blot test, the thematic appreciation test, the TAT, the projective drawing test. This includes draw a house, draw a tree, draw a person. Sentence completion test, so an ambiguous sentence that you can complete anyway. So for example, I am blank. Well, you could fill that out just about anyway. So someone that says, I am a father, I am a professor, I am a United States citizen, a psychiatrist could go, well, this indicates that you have a tendency to be fairly communal and you think of yourself as group membership. While someone that replied, I am strong, intelligent, and driven would go, well, you have a very internal focus, very individualistic focus. But someone might also go, I am lost and confused. And at that point, that is telling us something completely different. So again, they're very varied in how people can actually interpret these tests. There's also tests where you arrange pictures. So you're given a set of pictures and you're asked to put them in a particular order to tell a story. So our first test is Rorschach's ink blot test, published in 1921. The standard set has 10 ink blots. They include both color and black and white. It's kind of actually hard to find the actual 10. There is a pretty hefty effort by the psychiatric profession to keep these off the internet. I have some sample items here that I found through my own Google searches. The responses are viewed as symbolic of internal dynamics. So this is very much a Freudian view of the world. It's very much about unconscious. And it's a perceptual cognitive task, so how people perceive and organize situations. There are supposedly different responses that are expected from adults and children, and it's based on the location, the use of color, form and movement, and content. Now again, broadly what's supposed to occur here though is we're trying to measure personality, which is a belief of a stable trait of behaviors that differentiate us. I personally am not a big fan of any of the projective tests for the problems that we've already started to talk about. That there is no standardization, that you can give the exact same response to a particular ink blot. So for example, I'm going to look at, of the 4 that I have here, the top right, that's the all black and white image. And I'm going to look at it, and I might tell a psychologist or a psychiatrist that I see the face of a pug dog. I see his eyes and his nose. Each psychiatrist may interpret that completely different. In other words, there is no standardization that a pug dog means any one particular thing. So, if we're actually using this test to try to differentiate reliably, in other words, if you gave the same response, reliability of a Rorschach's test would mean that I give that response to 5 different psychiatrists and they all come to the same conclusion. That's the problem with these projective tests. They're not going to come to the same conclusion because there is no way to score guide every possible response to these ambiguous stimuli. So, as a reliably and valid measure of personality that can then be used to predict behavior or to predict fit with an organization or to diagnose people of clinical disability or clinical psychological problems, there is very little evidence that these tests are successful across the board. Now, some individual psychiatrists are fairly successful at using these tests to make discriminations and to make diagnoses. But that's an individual trait that they've developed. In other words, they've come upon a particular set of questions and a particular set of interpretations that seems to work. But that same psychiatrist using, or that a different psychiatrist using these same stimuli might come again with completely erroneous or wrong responses. The TAT, the Thematic Appreciation Test, was developed by Murray and Morgan in the 1930s. It's a series of cards with pictures on them, 30 pictures in black and white, and each one is a fairly ambiguous picture, and the patients are asked to tell a story about what is happening in the card. It's supposed to measure need for achievement, affiliation, and dominance, and also influential environmental events. So basically, it's looking at the idea that depending on the type of story you tell, you're going to get an idea of whether the person views themselves as a dominant person, a submissive person, whether they're going to be social versus non-social, and whether they have a need for achievement or not. Believed to have a reflection again of an unconscious theme. Basically, do you view yourself as a hero or do you view yourself as a victim? Once again, when we use these tests and ask, do they reliably actually predict future behaviors? Do they reliably give us personality information that lets us make diagnosis? There's very poor reliability and validity. Again, you have someone go into 5 different psychiatrists and give the exact same story for each picture. You're going to get 5 different diagnoses usually. And a tendency also to overdiagnose, in other words, to find problems when they may not be there. Here are some quick examples of some of the TAT. So again, someone looking at this picture is asked to make a story, and depending on that story, the psychiatrist or psychologist is going to make some determinations of kind of overall personality theory. So anyway, so for this particular picture, you might think of a young woman looking ahead to the future with a mother looking on that's proud of what she's become. Someone else might look at this picture and go, I see a woman that's decided to leave her past behind, and the mother is now worried that she'll no longer have contact with her daughter. And the idea again here is that the psychiatrist will then make determinations about the personality based on those pictures. Here's another one. So is this a wife that is worried about losing her husband because he's sick? Is this a wife that is slinking away from a drunk husband that's just beaten her? Again, the idea here is that it's an ambiguous picture. You could come up with pretty much any story, and the psychiatrist is then going to try to determine what that description or story reflects as far as your subconscious and conscious personality. There's also the children's appreciation test, so there's definitely the TAT for children, usually again 10 pictures made for ages 3 to 10. One of them, the CAT-A, uses cartoon animals in human settings. Another one, the CAT-H, uses human subjects. And again, they're ambiguous situations, and we're looking for, do the children come up with kind of typical normal action descriptions for the behavior, or do they come up with kind of more questionable or troubling stories for the picture? Another projective test is the projective drawing test, typically again done with children, house, tree, person. Developed by Buck in 1948. You can use pencils or crayon, and it's usually followed by a post-drawing interrogation. So it's not just the picture they draw, you usually then actually ask the subject questions about the picture. General interpretations, basically the house is an examination of home life, the tree is environmental influences, and the person reflects interpersonal relationship. So again, they're being asked to draw a tree, a house, and a person. Once again, when we put these to the test, when we ask, when someone actually says, how someone drew this person, house, and test indicates that they have problems functioning. How often do we find support for that? We don't find a lot of reliability or validity. So, again, multiple psychiatrists being given the exact same picture will often interpret that picture differently. And that means it's not a reliable test. And then when we ask them, does this person suffer from depression, for instance? If they say yes or no, rarely is that really associated with any other measures that we have of depression. The Draw a Person test, or the DAP, was Florence and Gutenberg, basically draw a man used for intelligence testing. So some of these tests can also measure a little bit of cognitive function. So your ability to draw, how well you interpret a drawing, can be an indication of kind of cognitive deficits. Karen Matchover actually refined the test in 1949 with instructions including draw a person and then draw one of the other gender and then tell a story about the two people. So again, how you draw the male, how you draw the female gives us information about how you view masculinity and femininity, and the story then gives us some information supposedly about how you actually interact in your own social interactions. The interpretation is generally clinically intuitive, and that is one of the important things to point out about these tests is they're clinically intuitive. If you have someone that looks at an ink blot and sees murder, if you have someone that looks at an ink blot and sees something very fear-inducing, it's very clear intuitively that that might be an indication of suffering from anxiety. That might be an indication that they suffer from an aggressive personality. But it also might mean they just like horror movies. And that's the problem is that we're making an inference based on someone as how they see the story of their inset basic personality. And again, the reliability and validity of these is very weak. So again, if someone draws a strong male and a submissive female and then tells a story about how the male has asked the female to marry him and she isn't sure but she decides to go forth and they still live happily ever after, there's a very clinically intuitive manner to interpret that this person has a high focus on masculine values but also has a traditional viewpoint. But when we then ask, does that interpretation result in predicting their behaviors in the future, predicting how they actually interact with other people? There's very poor validity. Kinetic family drawing test is another example of a projecting drawing test. Basically, you're asked to draw an entire family doing something. And again, the idea here is that you question the person afterwards. Why did you draw the mom doing this? Why did you draw the dad this way? Why did you draw the family members? And what were they doing? And again, clinically intuitive, someone draws a typical nuclear family of a mother and a father and 3 kids at a picnic, you would think well adjusted. If they showed a kind of non-typical family doing something kind of disturbing, like throwing a party in a graveyard, you would think, well, that's indicating something pretty dark. But again, maybe the person just likes gothic imagery and reads vampire novels all the time. It isn't necessarily a great prediction of how they actually behave. Another way to do projective tests is sentence completion. Patient is given an incomplete sentence stem and asked to finish. Completed sentences reflect, again, this idea of unconscious or underlying motives. Rotters is a better example of this. There's the Rotters Incomplete Sentence Bank. 3 forms. There's a high school, a college, and adult. Each one has 40 sentence stems. And generally, again, the interpretation is whether it's a positive sentence, a neutral sentence, or a sentence that involves conflict. So my greatest fear is, the best thing about my mother is, I'm proudest about. And again, there is no one answer. There is no structured or standardized scoring for this form. It's up to the clinical psychiatrist or psychologist. And the reason I keep mentioning psychiatrist here is most of these projective tests are more likely to be used by psychiatrists over psychologists. So there's further. The Rosenweiser picture of frustration shows 2 characters in difficult situations. Again, there's a child, adolescent, and adult version. In this case, basically, it's less ambiguous. It shows 2 characters clearly in conflict, but it's more about how the person views that conflict, the story they tell, and how they are. Is the story focused on how the 2 characters are frustrating each other, or how one character will actually overcome the other to achieve a positive outcome? Blackie's Pictures is another projective measure for children. It depicts pictures depicting a little dog and his family. And I have a couple examples here drawn from the internet. It's used for children. And again, we kind of have ambiguous pictures, but the top one, cartoon one, basically is showing the puppy actually suckling at its mother for milk. And depending on the story told, it's meant to get at Freudian concepts of oral eroticism. The next picture shows the puppy scared of an angel. And again, depending on the situation and how the child interprets that, it can be an indication of basically feelings of guilt. There's also adolescent appreciation or apperception cards, senior apperception tests, other placement tests. Like I said, there's a lot of these, but all of them are about ambiguous stimuli and then how the person responds. So the general problems with the perspective tests, again, one of the big problems is poor reliability. Every test that has been done of any of these has found that there is a great disagreement with trained professionals that supposedly have been trained to use these tests and actually the diagnostics or the personality profiles that they construct based on how someone responds in these tests. There's also very poor validity when we actually try to use these tests. So, for instance, if we actually know ahead of time that we're sending 10 people into a psychiatrist, 5 of them are very happy and go lucky, and 5 of them are prone to depression. The chances of these tests successfully identifying the 5 highly functioning people versus the 5 people that are suffering with depression is actually much lower than a self-report depression scale. So if they're less successful than just a quicker, easier test that can be scored without the use of an expert, what real good are they? The lack of standardized scoring, in fact, this lack of standardization has actually resulted in most courts and legal systems no longer accepting projective tests as court evidence. Also, there's been a fair amount of research that's found that the therapists themselves tend to project their own personality into the interpretations of other people. In other words, a therapist's interpretations of someone else's thematic aptitude tests, in other words, their projective test, is often a better valid measure of their own personality than the person being tested. So why are these still being used? Well, one, longly held stereotypes. There is a strong belief that these are a successful tool and an important part of psychology. And also, a fair amount of psychiatrists and psychologists still believe that though Freud may not have a provable theory, that the subconscious still is an active part of personality that needs to be measured. A lot of the interpretations do seem to make sense. In other words, there's a fair amount of face validity that if someone is giving a kind of scary response to an ambiguous stimuli, that might be an indication that something's potentially wrong. And there has been some research that has found that these tests can occasionally be useful not in making diagnoses or creating personality profiles, but in basically being a useful tool in therapy. So providing an initial dialogue between the therapist and the actual client.